At Jackson, they gave her a 2% survival rate, but with the constant battles and help from all the doctors, Victoria was given a second chance in life. Originally, she had a 2% survival rate, she was 17 days on ECMO, and 88 days in PICU. She needed to relearn almost everything from speech, OT, PT, everything under the care of the Jackson staff. Jackson's motto is, miracles made daily. This is true. Victoria is a miracle.
Thank you so much to both of you for sharing your story with us today.
I think most people here would recognize you as a tech pioneer in our region. And some people, he won't say this, but I can call him the godfather of tech in South Florida. But what I think maybe some people here don't know is that you did not begin in technology whatsoever. In 1980, you founded a real estate company called Terramar. Where did that shift happen to technology and mind?
So I've always loved technology. I've always been very curious. And you're right, I had a very successful and rewarding real estate career. But in the 90s, I became totally fascinated with the internet. And I felt that the internet was going to change our lives. And not having a direct technology background, I said, how do I start? So I started by doing what I know how to do best, which is the infrastructure that supports the internet. And that's how it all started. A lot of you know that Network Access Point of the Americas, a fortress building that is right downtown Miami. It used to be something close. Now it's all surrounded by multi-million-dollar condos, but that building connects Latin America, Europe, and North America, and 98% of the traffic goes through there. That's how I started, right? And that led to data centers, which led to cybersecurity, which led to hosting, networking, and all this complicated stuff that makes your application run. So I made a total transition. I love technology, and something that I also learned at the time was that you go through this massive tectonic shift. If you think about it with the internet, basically changed all of our lives, right? Then you have mobility, the same thing, changed our lives. Then you have virtualization, cloud computing, then cybersecurity. And every time you have one of those tectonic shifts, basically two things happen. A lot of capital is decimated, and a lot of capital is created, basically, in all these new companies. So my philosophy since then has always been, these changes are going to happen. If you try to foresee them, you stand in front of them. If you stand in front of a wave, you're going to get wet. You don't want to get drowned, but you're going to get wet. And that's basically what I've done through the rest of my career. Right now, we're probably one of the most exciting times that I have seen in my long tech career. And that is, everybody talks about artificial intelligence. It's absolutely true. There's a paradigm shift. But when you couple artificial intelligence with what's happening with quantum computing, every aspect of our life is going to be changed. And it's a very, very exciting time for all of us, and particularly the healthcare industry as well. So it's a very exciting time for us to be thinking about innovation in healthcare technology.
I don't look at it as a changing career. I look at it as very different. I think my career was always banking. I was a banker for 40 years, probably longer than a lot of people are alive around this room. But basically, when we merged, when I was in Charlotte, we merged Wells Fargo and Wachovia together. I said, I'm done. And frankly, at that time, I was coming back to Miami, part of my time between here and Colorado. And the city of Miami was having its own challenges, so I volunteered to run the city for a year, which I did. And then as we turned that around, Jackson was going through his own issues.
Yeah.
I have my own personal experiences with Jackson, similar to Victoria's experience. My son was born with only 1% chance of survival in 1978, and he's still around giving me a hard time. So, and among other things, my mom donated a kidney to my aunt in 1982 at the early time of transplantation for the worldwide, and obviously Jackson was at the forefront of that. And being a community person that I I've always been, and like Manny, we came over here not because we wanted to, but because we had no choice from our parents. We were kids. You know, I always wanted to give back to the community, and Jackson was going through his own issues at the time. And people said, "Why are you changing careers?" I said, "This is not a career move. I'm done with my career. This is I'm trying to do something for
Interesting
Jackson,
perspective.
and I'll be here for a couple of years." That was 13
Couple
years.
years.
And the idea was to turn it around.
Famous last
Be
words.
able to do it. But I just got sucked into what we do. The partnership with the university goes back to 1952, and the great things that you helped Jackson do together, which I guess we'll be talking about some of that as we go forward. It's days of frustration in
All the healthcare partners, and not only the physicians, but everybody that touches that patient, everybody needs to feel part of that process. It's not only the physicians that took care of Victoria, but it requires a team, and like the partnerships that we have with Jackson and so forth. But coming back to myself, I was a medical student at Jackson 30-something years ago. I came through my medical school, and I go, wow, I want to come back and train in Miami. I want to be part of the University of Miami and Jackson Health System and do my training, so I'm an intensivist and a pulmonologist. And then fast forward now, I'm the chief medical officer of the UHealth Hospital, the hospital and clinics. And with that, I have a great responsibility because the entire medical staff, meaning the physicians, report up to me from the hospital, including directors and service chiefs. Also, the other part which reports to the CMO office is the quality and safety and risk. And I want to touch about that because this is part of our mission. I always say it's very simple. The care needs to be good, evidence-based. You want to make sure that you standardize the care for all the patients coming through the hospital, that they receive the same care. Congestive heart failure patients, they all get the same treatments. Of course, there's some variations of patients.
Patient experience.
Exactly, but wait, we're gonna get into that, so 5 things, right? The care needs to be good, evidence-based, so it's part of my office and my team with the quality department, assuring that I work together with the physicians in developing these clinical pathways by the care evidence-based. That's one. I always say the care needs to be safe, meaning no patient should come in the hospital and have a hospital complication. And of course, understanding that certain things, that you're gonna have a hospital complication because it's inevitable for certain diseases. So the whole safety office working to minimize. I'll say we need to be efficient, and I really hope you touch on that, because the way our health systems are suing now, if you look at inpatient, we have a great need for inpatient beds. And patients are coming sicker and sicker. I just came from the hospital. We're close to 100% capacity. We depend, patients to be safely discharged back into the community. I want to touch into that a little bit. For us to create,
Making people healthier, right?
not only that, but look at the amount of people coming through the emergency department, all the 60 surgeries that we have planned for the day. We need to bed them, but we need to move, we need to flow. So quality, safety, efficiency, and you touch it, patient experience. The patients are our clients.
Yes.
So we try to create and promote a culture that everybody that touches that patient, no matter who you are, you're
Of course, I come up here and I said, Kevin, Miami wishes it had tech. Miami can have tech, but we don't have tech right now.
Big part of the reason that we ended up brainstorming, what can we do to make,
So basically, and that's how Emerge was born, right? Basically, the whole idea is if we come together as a community.
and the data also throughout our region. The second industry where you see the most venture dollars invested in and growing, it's almost catching up to fintech, is health tech. And so we want to be at the forefront of this together with the, with the leaders in this space, UHealth and Jackson, to bring this together for all of you, for the community. So hopefully, we can rally around this. Our plan is for this to grow year after year. We know the importance of this sector in our community. And I just want to thank personally also Carlos and your team, Dr. Janira, and your team, UHealth Jackson, for believing in us and saying, yeah, we're all in. As my father mentioned, Matt, Carlos, their energy levels and the way that we're collaborating as a team. I feel as if we are all one team. We talk to each other more, I think, than we talk to our own team. So thank you. Please.
Listen, this is just fascinating. I think we're only going to be able to
But
succeed.
there's a lot of innovations already happening. Radiology is a perfect example. Today, under radiology, the computers can determine exactly what the tumor is. And obviously, they never can talk about, hey, I'm chief physician, I'm not. But they can tell. And frankly, by the time the doctor looks at it, it's 99.9% right. I mean, the computer predictions are very perfect. And then, so it helps with the diagnosis, it helps with all that. Robotic surgery today.
Yep.
What's happening with robotic surgery? I mentioned to you that my mom donated a kidney to my aunt in 1982. Well, my mom was in the hospital for 4 days after donating the kidney. My aunt was in the hospital for 3 weeks after receiving the kidney. Well, today, a kidney transplant patient stays in the hospital for 4 or 5 days. And by the way, we're doing overnight, the donors are staying overnight, and we've already had 4 cases in which with robotic surgery that we're extracting the kidneys and they're going home the same day,
Wow.
outpatient. So these kinds of things are all through the new innovations and how to be more minimally invasive. And we're only touching the surface
Yeah,
of
we're
what's
just
gonna happen in the future.
Absolutely. I want to make sure time-wise.
Hospitals in the sense reserving the hospital for the patients that we really need. And this is what I see as our greatest opportunity to partner with public health agencies, with the industry, really come up with smart solutions that we can identify what are the issues, because it's not only about treating the heart failure and sending the patient home. Where are you gonna get your medication? How are you gonna get transportation? How are you gonna get your telehealth? Do you even have a computer to have your meds?
Right.
Do you have an understanding what you have? So we need to partner, we're already doing many venues, Jackson some more because of their mission, but that's true. Many venues to really try to position these patients in a way that we have solutions that we identify, we keep them healthier. Even setting up mobile hospitals and other things at home that you prevent them from coming. So to me, the challenge that we're gonna have is the number of inpatients that we have.
Right.
Obviously, we're always here to serve the community, that's not an issue. But I wanna just go back to one thing, because I think as we innovate, again, the opportunity is we are in academia. So we have that scientific rigor that by how we're gonna evaluate the information, really make sure it's meaningful. And we have multiple experts. But I think at the same time, we need to be careful not to block innovation, but you need to apply some scientific rigor.
Of course.
Without disconnecting from the patient.
Yes.
That's the most important, so, because.
No, that's the core.
That's the core. You have to be connected, that's why you have to partner with the physicians.
So interestingly, as part
What
of
it
our,
was. The kind of information and the size of the room was to be able to provide the additional equipment that was necessary with all these computers that you're dealing with multiple things that are necessary. When you're in intensive care, you got multiple morbidities, and it's not just even one issue. So you got to have all these different metrics and how to deal with that. So you have to have not only the equipment, but the size of the equipment, and then you have to have a centralized monitoring area in addition to the nursing that you have there. So it's innovation plays a big part. But your answer of challenges and opportunities, I would say today the challenges are what creating the opportunities. A big part of the challenges that we have today is what I was mentioning to you about the cost. Our revenues have been flat. Revenue per patient is flat because you can't get paid anymore, and the challenges of that. And even the ones that are insured, you don't have revenue, but we still have costs.
right,
And then the cost, especially with the inflation for the last couple of years, have dramatically increased. Margins have gotten very, very tight. So we need the innovation, we need to think different, and everything that we do
Streamline
to
processes.
be able to provide the kind of medicine that's necessary to take care of the patient. So this is the place where the business and the clinical care are aligned together.
yeah.
So the more efficient that we become, the more innovative that we become, it makes more sense from a business perspective, and it also makes great sense from a care of that patient. So the two of things are right. So as you're dealing with this, the length of stay gets reduced. How we take care of the patient gets reduced. The care gets improved. We're looking at just no longer having a bedside nurse that deals with this patient. It's how do you have all the different metrics and telemetrics environment on how to make sure that the patient is being taken care of
Yeah.
so we can act as quickly as possible. So all of that's happening today. Florida, and specifically Miami, was a great place to live and work. So we've been able to find so many people come from New York, and Chicago, and different
that's-
places.
yes,
Even Californians are coming to Miami. That actually has been a great thing for us, right?
Yeah, absolutely.
Now, the challenge that we have with that, of course, is that cost will increase. Real estate, for those of us who own real estate are happy about that, but the ones that don't own real estate, have a challenge on how do you rent an apartment, or how do you buy a house. Those are some of the challenges from a cost perspective to the community. So workforce housing is going to be at the very forefront of what we need to be doing in our community. And we, and you, Jackson, are about to kick off a major development for our employees and residents, because it's not just the employees. We also bring in 300 new residents a year. We teach 1,100 residents and fellows.
Right.
And in a very large teaching environment. And there's a lot of those medical students that want to come to Miami and learn in Miami. But if you say, well, I want to go to UM Jackson for my residency program, and it cost me $2,800 a month to rent an apartment, and I can go to Gainesville for $1,300 a month, where am I going to go? So the financial side of it has to do with it. So we want to make sure that we work on, so help that it's a big thing, and then beyond that.
The most exciting part, what are you most excited about?
What I'm excited about, the future. I mean, I think the future is great. We have to keep an eye on the future so we don't go through the normal cycles we do in Miami. For some of us that have been here a long time.
CDC and World Health Organization. So we would meet with the mayor every single Saturday for several months to really come up with, and there's no political connotation, just to understand how the pandemic was evolved and how could we come together, what we're experiencing in the hospitals, to really come up with things that are really going to make and benefit the community. So what I'm trying to say is that I think they unified the positive lessons, if any, from COVID was the unification that we had for the community. It was so fascinating to see
How everybody came together.
how it's here. And if you look at our health systems, the way we are now, our hospital is a completely different hospital if you look 5 years back. And if you look 10 years back, oh my God, it's just transformation. So what excites me the most, because now the Hopkins of the world, the Mass Generals of the world, the UCLA, the Emory, all these people, they're all going to come here. Because they want to make a difference here in this community. And here's the opportunity, which excites me the most, is the future for our healthcare systems to really benefit and part from the community.
Agreed.
Because of booms and then we bust, and the cycle went on, starting in the 1920s and all the way to recently. One of the things that is happening now is that I think that is over, basically. I mean, we were on a good trajectory even before COVID. It was 19 was a great year, just overall. It was a lot easier to recruit, it's a lot easier for entrepreneurs to be here and all this kind of stuff. And of course, COVID accelerated all that. And what is happening right now is Miami is institutionalized. We're now on a global basis at the same level as Singapore, as Hong Kong, as Sao Paulo, as New York. I mean, everybody's looking at us. We had a dinner last night where Ken Griffin was there with Michael Milken, and Ken Griffin has moved the entire headquarters of Citadel from Chicago to here. It's not just, they used to put representative offices here, or sales offices here, LATAM office here. It's over. This is the headquarters that are coming here. No question that there are challenges. Any major city that has success will have challenges, and of course that digital and wealth divide is one of the most pronounced challenges that we